the Toronto Star. I'm Reggie Mudler, and this matters. On Monday evening, the Toronto Star published an exclusive article informed by leaked data that showed that positivity test rates for COVID-19 in over 2/3 of the neighborhoods in this city are soaring. When pressed about this information, here's what Premier Doug Ford and Ontario's Associate Medical Officer of Health, Dr. Barbara Yaffe, had to say in response at Tuesday's COVID-19 briefing.
Well, I did see the data probably about a couple hours ago. They showed me the data, and you're 100% correct. It's in the certain areas, and one being in my area. And that's where we have to focus on. We go out there, we put the mobile testing units up, get more advertising within those communities. And no matter if it's mainstream media or if it's the ethnic media, we're still pumping millions and millions of dollars to educate the people. But I'd like to hand that over to Dr. Yaffe, if I could.
I haven't actually seen the data myself. I've read the article in the paper. That is very concerning. Those rates are high. And those are neighborhoods and areas that we already knew were at increased risk based on other data.
Today, we are joined by the two reporters who broke this story, and they will explain further and provide some context to these alarming numbers. Kate Allen is the science and technology reporter for the Star. Jennifer Yang is a Toronto Star reporter covering COVID-19. I want to thank you guys both so much for making the time to chat with us today.
Thank you.
Thanks, Raju.
So, Kate, I think we're going to start with you. And I believe these numbers come from some leaked data, but I think we need a little bit of an explainer. We're going to be talking about test positivity rates. What are they? Why are they important? And why is 3% a key number?
Yeah, so there's lots of different metrics you can use to track how the epidemic is going in a given place, like Ontario or like Toronto. And test positivity is a really interesting one because even when testing capacity is constrained, it can tell you about the levels of community transmission. So we know that people are having a hard time getting tested in Ontario right now. There was long lineups for weeks and weeks. That probably turned off a lot of people who didn't bother to do it or couldn't do it because of work. And then Ontario made this switch to appointment-based bookings. And we know we have this huge backlog. So our case count numbers are likely to be kind of influenced by the fact that not everybody who needs a test is getting tested. But even as that's happening, test positivity, so that's the percentage of tests that are coming back positive for the coronavirus, that can tell you about the levels of transmission in the community and the extent to which they're surging. So as they go up, so really, really low ones are good. It means that there's not a lot of transmission going on, and also that you're probably catching as many cases as are out there. Like not 100% of them, but you're doing a pretty good job at picking up most of the cases of COVID-19 that exist out there. As the numbers start to rise, as the test positivity starts to rise, it shows that just transmission is increasing in the community. And it's also a worrying sign that there's likely to be more cases out there than you're catching through testing. So 3% is a threshold. I mean, it's sort of an arbitrary threshold. You could set it a little bit lower, you could set it a little bit higher. But 3% is sort of a number that public health units in different jurisdictions have settled on as the number they want to keep it below. So Toronto Public Health, for example, they have various metrics that they follow on their indicators dashboard of how the city is doing. And test positivity being under 3% across the city is their goal.
Okay. Now, the alarming thing is some of this data shows that some of these test positive rates around the city are around 10%. What does that mean, and where is that happening?
Yeah, they're actually above 10% in a few places. 3 of those places are in the northwest corner of Toronto, which is a part of the city that we know has already been disproportionately affected by the first wave of the pandemic. And now we're seeing test positivity rates in that area above 10%, which is really concerning. Another one is around Yonge and Eglinton, just sort of north of Eglinton and Mount Pleasant. And that's a new one. So one thing I should say is that like any metrics or any statistics, test positivity has its own limitations. So for example, if they send in a dedicated, like a targeted testing team into a neighborhood for some reason, that's going to end up turning up more cases. So that can momentarily boost test positivity in an area, which is actually a good thing because you're finding cases in an area where, you decided to look. An outbreak can also boost test positivity because again, in a long-term care home, if they start getting cases, they're going to send people in and swab everybody in the entire long-term care home and all the staff. And that's likely to find more cases too. So these things can influence test positivity in a certain area. So there's lots of different reasons why test positivity could be above 10% in a certain area. But the experts we spoke to said that no matter what, numbers like that are very alarming. The other thing that we saw in the data was that there was a huge number of parts of the city. So 2/3 of the city was over 3% test capacity. And there was lots of neighborhoods that were above 7%. Above 10% is like really, really a lot. Above 7% is still very concerning. And parts of Scarborough saw test positivity rates above 7%, and parts of downtown, including Trinity Bellwoods, sort of St. Jamestown, Cabbagetown area, and the Church Wellesley area.
So this is widespread all over the city. This is very troubling. Jenny, I do want to bring you in. Let's talk a little bit about that northwest corner. Like, this is an area you wrote about and was hit badly in the first wave. What do you think this could mean to that area? And I guess the other question is, shouldn't more have been done to potentially help them in this second wave?
Well, that was already a question people were asking after the first wave when we saw how much harder hit these communities were by the first wave. Experts we spoke to said this should have been well predictable. We already know what the social determinants of health are. We already know that these communities have poor health outcomes for all sorts of reasons that have to do with systemic injustices and systemic racism. So we should have known that these communities would bear the brunt of wave one. And we really should have known that these communities would be at greatest risk in the event of a second wave, which just about everybody we spoke to predicted was coming. It was never an if there would be a second wave. It was always a when there is a second wave. So yes, in light of our story, I think people are really asking that question. There was no excuse for not protecting these communities better the first time around. And people are really scratching their heads over why these communities aren't better fortified for the looming second wave that we're already seeing the beginnings of, or really well into the beginnings of. So yeah, that is definitely the million-dollar question right now when we see these alarmingly high positivity rates in communities in the northwest corner and other pockets of the city that also have higher proportions of lower income households and racialized populations.
Kate, you brought up the limits of these tests. I believe there's already a discrepancy with what is the official data. Obviously, this is leaked data. So again, let's talk a little bit about the limits and why aren't we hearing these numbers from official sources yet?
So the number that is on the Toronto Public Health dashboard right now is that the citywide test positivity rate is 2.5%, which is within their goal range of under 3%. But that is from data starting the week of September 20th. So getting on like more than 2 weeks old now. So they updated on Wednesdays with the previous week. So tomorrow we'll see the data from last week. Our data is more current. It already shows us test positivity from last week. The short answer to the question is our data is more up to date. So the other thing is that the Toronto Public Health's 2.5% number is a bit older than our 4% number. But the other thing is that Toronto Public Health doesn't break this data down by geographic regions in the city. The data that we got does do that. So right now, there is no public source for the information that we have showing test positivity by neighborhood. And I think a lot of people who have read our story would like that data to become public.
I know I would. We'll be right back. What are the experts saying that we need to do? What can we do to stop or slow this down? Is a full-on lockdown the answer?
Jenny, you want to take this?
So I think a lot of experts are saying that the blunt instrument of an across-the-board lockdown, like we saw with the first wave, is not the best approach now that we are all heading into a second wave, because we've learned a lot more about this virus, how it spreads, and which vulnerable populations are at risk and which settings are highest risk. So it really makes sense to do more targeted interventions and measures, but it has to be evidence-based, it has to be thoughtful, and it has to make sense in terms of where the risks are highest of transmission. But the asterisk next to that is that we can do those really fine targeted measures early in the epidemic curve when cases are just starting to accelerate and pick up, because there does reach a point where the cases are just so widespread across the community that those targeted measures aren't really going to be as effective anymore. And you then do have to turn to some of the more blunt instruments of really just doing across the board lockdowns of specific industries or what have you. Because I think if we want to look into the future of Toronto, we might look to Melbourne for an example of what we might be in for. Melbourne went into second lockdown, or they announced their second lockdown on July 7th. And that city, which has bigger population than Toronto, but sort of in the comparable zone, has seen their citizens kept in their houses unless they have to go out for essential shopping or caregiving or work or exercise. They've only been allowed to exercise at first for 2 hours outside at a time, and then it was changed to 1 hour. They implemented a mandatory mask law. You could only leave your house with a mask or face penalties. You could not leave 5 kilometers of your home. You had to abide by a curfew, which was implemented, I think, in August. And schools went back virtual. Most grades, classrooms were sent back online. And that started July 7th. It is now into October. They still have lockdown restrictions in place, but they're finally bringing their second wave epidemic under control. It's taken that long to get their second wave into a manageable situation. And they were in a way better off situation than Toronto is at the moment. I mean, we were looking at the active number of cases Melbourne had when they implemented their second lockdown, and it was only, I believe, 97 active cases. Toronto had 97 new cases on September 9th, which is nearly a month ago. So we're really behind the curve compared to Melbourne. So looking at what they went through there, I don't think it's looking good for what we might expect to experience over the next couple of weeks or months here in Toronto.
I wanted to talk about places around the world. Melbourne's a good example. And then the other place I wanted to bring up is New York City, which is now closing down a number of hotspots. And a lot of it is because they've got those positivity rates above 3%, correct?
Exactly. So you're seeing this now in New York. This has just kind of happened in the last couple of days. 9 neighborhoods in New York have seen 3% positivity rates for 7 consecutive days or longer. And lockdown restrictions are now being imposed in those specific areas. And some of these neighborhoods have like 100,000 people or more. So New York is trying kind of this targeted approach. But, their threshold was this 3% that Toronto Public Health is also using. And that was sort of a trigger moment for them to switch on these lockdown measures. And here in Toronto, as Kate was saying, we're already well past that point in a lot of pockets of the city. And, in 3 or 4 neighborhoods already beyond 10%. So New York City is making the moves. And so far, Toronto is in lockstep with the rest of the province in terms of the restrictions we've introduced here, even though our infection rates are really starting to skyrocket.
But hey, let's all go to the casino. Anyway, I'm kidding. But I think the other thing is, okay, we've learned a lot about this disease and about the speed and rates of transmission. I think there's been a lot of studies, particularly in China. What can we learn from them, and how much time we actually have to act to try and stop or slow this?
Yeah, so this was one thing we wrote about in our story. There's this really interesting paper that was published in a journal called Nature, which is one of the most reputable journals out there. And these researchers looked at lockdown interventions in China, which of course was the first country hit by COVID-19 pandemic. And they found that timing is kind of everything when it comes to imposing interventions that'll work. And waiting even a single week can have huge consequences. So these researchers basically looked at China and found that by February 29th, I think was the date, there was over 100,000 cases estimated in the country. And they did some modeling work, and they found that if China had waited even a single week more before imposing those lockdown measures, they would have seen 3 times more cases. And if they had waited 3 extra weeks before implementing those measures, they would have seen an 18-fold increase of cases. So you really can't hesitate with something like COVID-19. Every passing day really matters.
I'd like to ask both of you this, because I know you've been dealing with a lot of public health officials. What do you think about the messaging that is occurring right now. And personally, Thanksgiving weekend is coming up. And, my family, I'm feeling a lot of stress because I think that we should not be doing anything. My mother and some cousins have a different idea. So you've been talking to a lot of experts. We know a lot about this. What do you think the difficulty is here in sort of getting the message and how serious this disease is across the people?
There's definitely a bit of a dissonance when you cover these topics day in, day out, where, we're clearly in a much, much, much worse place than the first wave right now. Like in the first wave, we put in basically across the board lockdown when we had just a few dozen cases. And then after those lockdowns, cases rose to 600, 700 a day. Now we're at 500, 600, 700 a day. And we have, just a scattering of public health interventions that have been put in place in the last few weeks. So it feels certainly weird that the data shows we're quite clearly in a very bad place, but yet life seems pretty normal right now. Obviously, in a lot of ways, it's not normal, but there doesn't seem to be the same urgency that we felt in the first wave. I don't really know what to say about that. It's definitely a bit of a dissonant feeling.
I think part of the thing here is it seems to be one of political will. I mean, it sounds like Toronto Public Health wants a lockdown, but the province is balking. And I know you guys aren't political reporters, but since time is of the essence here, what would you want to say to our officials and why they need to take decisive action right now?
I would really point back to that Nature study that I mentioned earlier in this conversation, in which we mentioned in our story, which just highlights the importance of hesitating for even a single day or a week, and what that can translate into in terms of additional cases and additional deaths. We're past the point of hesitating, I think, and I think the consensus across the board amongst experts that we're speaking to is it's now very much so the time to act. I think a lot of people would have liked to see action a week ago or 2 weeks ago even. As you say, we're not political reporters and I'm not a legal expert. I know a lot of issues are sort of around the legalities of who should be in charge of imposing these measures. But basically, there's not enough time to fight over this, and whatever needs to happen as soon as possible.
The other thing I wanted to bring up is because of the backlog in tests, the contact tracing being suspended, is our next set of numbers about these rates going to be accurate, or are they also going to be inflated or deflated because there's been so many issues with testing right now?
Because there are so many issues around testing right now, it's pretty likely that our case counts are going to flatten out over the next week or longer, or even probably not drop, but it's possible they could drop. And so case counts, like the daily new number that they announce every day, which can be very headline grabbing, is less likely to be sort of a good number to pay attention to going on, because the number of people tested is highly dependent on how many people you can get through the assessment center system, which right now is having lots of issues. And this is another reason why test positivity is such an important thing to watch, because independently of how many people you test, you can watch whether the number of people testing positive is going up. So that's one reason to pay attention to that. But there's other metrics to watch too. Hospitalizations is a really important one, both because, again, it's not dependent on how many people you test. If you get sick and you need to go to the hospital, you're going to go, whether you've been tested or not. But also because that's obviously a real weakness, a potential weak point, that if the system gets overwhelmed, that can be disastrous, as we've seen in other countries. So that one's really important. So not just hospitalizations, but ICU admissions and deaths, of course. And the other thing about those three is that they're likely to lag a little after rising case counts. So it takes a while after someone tests positive to get sick enough to go into the hospital. And then it takes a little while to be sick enough to be moved to the ICU. And it takes even longer to unfortunately die of COVID-19. Those are all important metrics to watch, but it's unlikely that they'll all be telling you the same thing all at once.
Well, guys, this is a really important story, and I'm glad that you came on to talk about it. I want to thank you both for your time today.
Thanks, Raju.
Thank you.
Kate Allen is the science and technology reporter for The Star. Jennifer Yang is a Toronto Star reporter covering COVID-19. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Budler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.